Hello, I'm Dr. G. Ramesh, Senior Consultant Cardiologist, Yashoda Hospitals, Secunderabad. So, a common question is, how do you have diagnosed symptoms of heart disease and what is the pathway of symptoms to stenting? So, essentially, if you have any symptom of shortness of breath, if you got chest pain, these are the symptoms you have to be careful about. Particularly if you got some risk factors such as diabetes or hypertension, you go ahead and visit a cardiologist. The cardiologist sees you, probably finds something abnormal in the ECG or an echo or a treadmill test. He'll do an angiogram. Once an angiogram is done, they will generally diagnose some of these blocks. If the block is less than 70%, the medical management is what is advised. If the blocks are more than 70%, you have two options. One is you can go for stenting, second is you can go for bypass surgery. If you go for a stenting, what is the option? So generally most of the vessels nowadays, you can go for stenting. So once you do stenting, what is the options for us? Generally, if the patient is in non-emergency state or if the patient is in a relatively stable condition, we discharge the patient in a couple of days. Once the patient goes home, there are certain precautions he needs to take. The single most important thing is he needs to continue those medications. Many people ask us, do we need to take medicines? Post-stenting, we use what are called as blood thinners. So, couple of blood thinners are always given with a cholesterol reducing medicine called as statin. So these three medications are must for any patient for at least 1 year. So you should not stop these medications without consulting a doctor. That is the single most important. Second is a diet. So you should probably take a less oily food, predominantly vegetarian diet. Third thing is your exercise and walking. So these three things are most important for any patient post-stenting. That's the most important thing. If it's an emergency, probably the patient will be getting discharged in 2 to 3 days or a little more than that. But the other follow-up is just the same for these patients.
If you found this video useful, like, comment, and subscribe for more health updates.